IBNX Radio.
With your host Ricardo D. Rice, and hey, for the first time in a very long, actually I think ever, I'm in the studio solo today. So it's just me, and we're gonna have some interesting conversations. So you guys definitely want to head over to my Facebook at Ricardo Ricky Rice to watch the live feed and be able to interact with me. Because as I throw out some things, I would love to have your feedback. Also on Instagram at RD Rice. That's RDWRICE. Remember, every time I say my last name, it's spelled WRICE. So you can go there and comment. So yeah, we're going to have a really good show today. It's just me solo. And we'll have a guest. Dr. Nikki Hill will be with us a little later on in the show. So yeah, it's going to be an interesting day. So over the weekend, there were some interesting things that took place. Some things that did kind of incite me, some things that kind of annoyed me, I will be honest about. So, you know, let's just get right into it. So over the weekend, they finally got Mr. R. Kelly. They finally got R. Kelly, and it's just not a good situation. Everybody kind of knows how I feel about the R. Kelly debacle. And that's, if we're going to get R. Kelly, then we should get everybody. We shouldn't just take R. Kelly down because he wasn't the only person that partook in this. And thanks to the documentary, you pretty much have everybody that was involved in that whole scenario a confession. You have it on tape. So in my personal opinion, taking down R. Kelly by himself, one, does not solve the problem, and number two, I honestly don't feel like it's fair. Like I said, I think that everybody that was involved in it should go down as well. But, you know, at the end of the day, everybody was bucking for R. Kelly because he is the man, so to speak. But doesn't make me feel good or feel warm and tingly on the inside at the end of the day. So he actually turned himself in, and they set his bond at $1 million. And apparently he could not make bond. So because the bond was $1 million, he had to post $100,000 to be able to get out. The Cook County judge, Judge Fitzgerald Like Jr., is the same judge that actually presided over the Jussie Smollett's bond hearing. So if you were watching over the weekend and you saw all the memes of Jussie and R. Kelly side by side, that's why that was, because the same judge that tried Jussie was the same judge that actually tried R. Kelly as well. So yeah, again, it doesn't make me feel good to know that R. Kelly went down by himself, but then we also discovered that R. Kelly couldn't make bail. So, yeah, that was a whole nother debacle, that R. Kelly could not make bail. His lawyers were saying that hard times, child support, bills, a whole plethora of a lot of things that came up were the culprit behind why he could not actually post the bond. So, again, that causes another problem for me because I'm just like, okay, if R. Kelly's been making all this great music over the years, and this is where we get into the breakdown of why artists actually do not have the money we feel they should have, especially artists who have been in the industry for a hot minute. You know, why doesn't he have enough money to make bond? Is his child support that high? Like, these are the kind of questions that come up when we talk about artists, because then we start looking at the Tony Braxtons and the TLCs of the world who have actually broken down and said, well, hey, yeah, we've been making albums, we've been making these great singles, but when you get down into the breakdown of how they're actually paid, and Double R has talked about this on a number of occasions, when you start talking about a tenth of a tenth of a tenth that artists are actually getting for the music they make, or whether they own their masters and things like that, which will change the scenarios of how they actually get paid. So now for me, the question becomes, you know, does R. Kelly own his masters? Other questions, how much is he getting paid? Because you would figure that an artist that has been in the industry for that long would be getting a greater percentage for their music because their catalog is so extensive. But that's another question that comes into play. But, of course, nobody's going to care about that because at this point, everybody just wants R. Kelly to go to jail. Now, again, don't get me wrong. I absolutely believe that R. Kelly is guilty of these things, even though he declares his innocence. So he's standing by the fact he pled not guilty to a lot of these charges. So he still stands by his innocence. We all know how that's kind of going to go. But you never know because he has to be tried by a jury of his peers. So you never know. But I'm not saying by any stretch of the imagination that R. Kelly is innocent. But what I am saying is that we should consider all things. And it's kind of the same way I felt when it came down to Bill Cosby. And the fact that after Bill Cosby was tried and found guilty and all these things, we stripped him pretty much from history. That was a problem for me because everybody knows that I adore Bill Cosby. And again, I'm not negating that they didn't do any of these things. I'm just saying the way that they're handled should be looked at a little differently. And not because they're celebrities, just because of the place that they've held in history, especially African-American history, particularly Bill Cosby. You know, this is the man that raised a lot of kids, especially African-American kids who did not have fathers. You know, this is the man that set a whole new standard for the way that fathers took care of their kids, the way that fathers loved their kids, the way that fathers loved their wives, or husbands loved their wives. So, you know, I still have that feeling that we should be a little more sensitive because these things are a lot older and a lot farther away. So it does kind of make me feel some kind of way. But again, I am not negating what R. Kelly or Bill Cosby did, and I'm not saying they should not be punished. I just think that the way that we punish them should be thought about a lot more intricately than the way we do it. So that's my little take on R. Kelly. But again, R. Kelly has turned himself in, and he's in jail because he cannot make bonds. Now, I did read on, because I started reading Black Twitter. I know. I started reading Black Twitter, and on Black Twitter, they were saying that, actually between that and some other sources, that some of his female fans were trying to start a GoFundMe or a page to actually raise his bond so that he could get out of jail. Imagine that. Again, I have not muted R. Kelly. I still kind of like his music. I still listen to it, but I can also separate the man, the artist, the man from the artistry. So I love his music. Don't really have to care for him as a person, but like I said the last time, when I put on I Believe I Can Fly, I really feel like I can fly. So I'm still happy with R. Kelly music, and a lot of you are too, because when Step in the Name of Love comes on at your family reunion, you still stepping. So again, I just feel like we should take in consideration the contributions that people have made, not negate what they've done or what they're guilty of, but I just feel like we should take those things into consideration. But that's just my little take on it. So that's the whole R. Kelly debacle. All right, so we're going to take a break, and when we come back, we're going to have more with this and other current events on the Leadership Blend with your host, Ricardo D. Rice.
I love you, until I find the day, the only words I know that you, until I say the only words I know that you, until I
know you see it, girl, this ain't sitting real good in my soul. Everywhere this little girl goes, she pick up another obstacle. She was my heart, I don't know the tribe or the fall, but by default, she don't think of me. I thought she was an Indian. She be slanging things like a simian. All my life I wanted me an Indian. And now she's far away, but I had to know. Listen, I know you see it, girl, this ain't sitting real good in my soul. Everywhere this little girl goes, she pick up another obstacle. She was my heart, I don't know the tribe or the fall, but by default, she don't think of me. I thought she was an Indian, but she be slanging things like a simian. All my life I wanted me an Indian. Ooh, girl, let me in. In the street with a wedding ring, and she hit the bar, city babe, are you down to cheat? He looked in the eye, chivalry, is he really dead? He pulled out a tip, jumping right on them, thinking was it good to intervene, and I lost her. Lost her to the world and the girls and imposters. Entertained, I died of the pain and the cost her. I ain't mad at me, but it hurt. And I thought she wasn't in it. Now she only worried about the Benjamins. She been lurking in my dreams. I swear that eyes on me. Good night and all. I swear that eyes on me. I swear that eyes on me.
All right, everybody, we are back on this Monday edition of the Leadership Button with your host, Ricardo Rice. And joining me in the studio, she has this look on her face like, nigga, don't act like you're new to this. Like, we've done this before. Not here, but we've done this before. So, you know, you're like a friend to the show, and you're engaged to one of my favorite cousins. So, you know, this is not new. So
I can't call the new card.
no, you
Okay.
cannot call the new car.
Okay.
You're just in a new studio. But considering where we were at that little table in that little area, you know, this is
Got some breathing room.
exactly. This is a lot of breathing room. Like I said, my correspondents deserted me today, so they're all fired. Yeah. So outside of that, we have the lovely Dr. Nikki Hill with us today.
Yay.
So tell them about yourself. Give them your background. Tell them what you do.
Okay. So I'm a dermatologist, a medical hair loss expert, and a hair transplant surgeon. Right here in Atlanta, Georgia, I opened a practice called SOCA Center, Skin of Culture and Hair Center, where we focus and specialize making sure everyone's beauty and their personal brand shines through.
That's. I don't think you described it that way last time. That's.
We've
it
gone
shines
through a little
That's-
changes. It's all about personal brand now, right?
That-
Hair,
I like
skin,
that.
nails.
That's.
It's how we introduce ourselves. It's how we present ourselves to the world. So everyone's walking in their own light, their own personal brand. So we just want to make sure their flavor is how they want it to be.
How did you come up with that name? I always want to ask you that. How did you come up with that name?
Skin of Culture and Hair Center. So I wanted something all-encompassing. I wanted something that focused on the aspects of dermatology that I kind of had to go a little bit outside of my traditional learning and teaching to really understand, which was cultural skin disorders, treating pigmentation disorders, and as well as hair changes, which is a niche within dermatology. So not a lot of dermatologists know about hair loss or sometimes want to really engage in the dialogue of hair loss. And so Skin of Culture and Hair Center.
Yeah, we usually just give weaves and toupees and just call it a day.
We're going to talk about that today.
You actually get into things, but you have a personal story that got you into all of this, right?
Absolutely. So it was one of those times where you think you're just going. I was trying to study for 2 boards, trying to be chief in residency, trying to do a lot, trying to keep up and just survive. And while I was thinking I was mentally handling it, my body and my hair in particular was like checking out. And so in a quick moment, I started shedding aggressively, started seeing about 50% of my hair falling out. And that's when I started understanding how stressful, how upsetting, and how difficult it was to really, 1, engage in dialogue with that, but then 2, to try to find answers. And so that's when I quickly realized, okay, a lot of individuals who are helping me with, dermatology in general didn't really have a love to really understand about hair changes, and a lot of it was just, just waited out. And so I really had to go outside of the field and search for a hair loss specialist. I was in dermatology to really get answers. And one, getting answers was a huge just weight off my chest, because it's a downward spiral. It's like, don't stress, it makes it worse. Okay, well, you're stressing because you keep seeing the hair changes, and then they're saying, what's this, what's that, but having to do blood work, having to like get a good understanding of what was going on, getting on a treatment regimen, that made the world of difference for me. So I was really thankful for finding that. And that's why I said, when I get out and I get into my open my practice, I really want to focus on hair and focus on individuals, so that way we can stop this process.
So your hair is always like this pretty and silky, like a Sassoon
Ooh,
commercial.
all right now.
Everybody that can
You better
see, okay.
tell the good
Everybody
people.
that can see Dr. Hill, she's gorgeous. So
Oh,
this
thank
is the
you.
same hair that your hair was always this texture. So your hair was falling out when it looked like this.
Yeah, quickly.
Ooh.
Quickly.
Wow, that's different. So with your practice, you can work on all types of hair.
Yes.
Do you specialize in African American hair or just all types of hair in general?
Now, because I specialize in all types of hair. So when I did my hair training and scalp disorder training, hair loss and scalp disorder training, we focus on all different types of hair. So I have a particular, of course, affection and particular relationship with African American hair. However, we do treat all types of hair.
Okay. All right, so let's get into these questions that my great cousin sent. So why are people losing their hair? Outside of stress, is there other factors that factor in?
Absolutely. So there's actually over 20 different types of hair loss conditions.
Seriously?
Oh, yeah.
Please tell me they all have like different symptoms, or do they all kind of look the same?
No,
and you just gonna-
some of them have little flavors of their own. Some of them present differently, but one of the most common reasons right now is because everyone's on their like extension game and weave game. So I got to bring up traction, because hashtag save our edges is like serious.
Is that a thing?
It's a thing.
Save our edge.
It's real.
I wonder if I use that. I'm gonna have to use that. They say
It will probably pop up a lot. I mean, because
I mean,
traction.
is beauticians use it or just everybody? Like,
I think it's touched on a lot of people's lives. And then the
Save
lace fronts
my
came
edges.
out, and then at first people were gluing down the lace fronts, and then they were trying to not use the glue, and then we still had like all the micro braids and the mini braids. It's just too much. When there's too much tension and too much pressure on hair follicles, more than what those follicles are actually supposed to carry. If they're weak, they break, and if they're strong, and the weakest point, unfortunately, is where they're anchored down into the scalp. And so when that gets traumatically pulled out by too much weight being on that hair follicle, the body sees an open wound. It doesn't know to regrow a whole new follicle or regenerate a follicle. It just says open wound, close it with scar tissue. And so unfortunately, that's why we start seeing a lot of ladies who have lost these edges. And as young as little girls. We see them in little girls. We see them in guys with the man buns. We see them in locks, sister
I didn't
locks.
even know the man buns was a thing. Don't get me started. I'm still trying to understand a man bun. Like, especially, I'm not being
just
funny.
whip it up there.
For African American dudes, I'm just like, you don't even have like that type of hair. How did you get a man bun? Like, okay.
People are doing the things now.
All right, so I have a question about this weave debacle. Okay, so lace fronts, because I'm trying to understand all this. So lace front is what? The hair is put on something, they just put it on their head, and I don't get it. So, because there's like weaves, this is just my personal outlook. So there's like weaves, lace fronts, braids, natural hair, like it all just lumps together for me. I don't get it.
You speak those words.
I know that my family's gonna kill me. But look, this is my day to be honest, because we got the doctor here. So I'm trying to understand, how do we get to lace fronts? Explain the lace front, if you, because this.
Okay, now it's a little outside my zone, but I'm learning from what my patients come and tell me. So,
Yeah, see, so
word
we
on
gonna
the
learn
street,
together.
Yeah, word on the street.
Not word on the
is,
street.
So with the lace fronts, like they have like a little mesh, and then it's a fine mesh. Some of them are softer, some of them are a little bit more frictional and more irritating with rubbing. But they have the hairs that come directly into the net, so the hairs are kind of threaded through, and it looks like a wig essentially. However, you just have a little bit of a lace front, so you can have that natural frontal edge.
Yeah, I've noticed that.
So initially, they were for like actresses and actors for roles, and if they need to kind of change up everything. And so they would sometimes even shave that little part in the frontal hairline so they could adhere it down and blend it with their makeup. Well, we've taken that and made it into an everyday situation. To an everyday situation, to the point where sometimes I think there's been a little bit of neglect in regards to the adhesive that was placed in that area or how it's being removed. I've seen, unfortunately, some ladies where they just kind of pull it up, and I'm like, there are precious hairs under that adhesive. Please be gentle.
So are they gluing it down, or is it like a
Sometimes
stocking
it's
cap thing
glued.
that just sits on the head?
That's usually what they wear underneath a wig. Some ladies may wear a wig cap, which is like a stocking cap under the wig, which I don't like either because there's adhesive in there a lot of times, and it's pressure. And so if you can imagine, you're literally like pulling on those hairs a little bit. Because if a wig cap, wave cap.
Yeah, a do-rag.
Different than do-rag, though. It's like
There's a difference?
It's old school wave cap.
Nikki,
old school
you pulling
players.
my leg. What is you pulling my leg? What is the difference between a do-rag and a wave cap? Like, it all looks the
So,
same.
the
Because I'm bald, so I don't use either one of them anymore. I used to, but I don't use either one of them anymore.
So the do-rag is, they got the tail. The do-rag got the little, the
But
top.
you can have a tail
and
with the wave cap.
Not the original, not the old school one, which is basically like the stocking.
Oh, we still use those?
No, but that's what a wave cap and the old school wave cap is.
Oh,
The same
yeah,
material. It's
they were
nylon.
like- oh, yeah.
So that's why
yeah.
old school they used to put the stockings. They used to put the
And then
stockings
somebody
on
got
their
smart and started
head.
selling them and putting a title on them
Right.
and started putting them in the store. I'm not mad at it. I'm just mad I didn't come up with it. But
Yeah, so it's like that elastic band there in wig caps or the old school wave caps that pulls essentially. So I always tell them if they can cut it, if they can snip it, if they can make it not so tight, so we're not again pulling those hairs out. So that's under a wig cap or old school wave caps. And then rolling forward to the do-rags, that's when they have the tail hanging out and they just tie the long band
now
around.
that you made me think about this, what is the purpose of having a tail? Now that you made me think about this.
That's for the fashion sense. They used to tuck it in, roll it in. And look, I went to Clark Atlanta, so
Oh yeah, you were at ABC.
they were quite fashionable with the do-rags back then.
That's
And then the lace front. So now a lot of ladies, they don't adhere them down because they wear them on a day-to-day basis. So they take it off when they get home, they put it on, which is fine. You just want to make sure, again, those baby hairs, those little edges, you're not causing too much friction in them. And so that's where it always kind of, it's a cross and a fine line between wanting to wear any type of weave or extension or braids and then needing to for camouflaging purposes. And that's like a huge part of my practice. We want to catch them before they get to having to, it's a requirement on a day-to-day basis to feel comfortable to leave out their house that they have to have a wig or a weave or a lace front versus they want to do it for a fashionable sense or they just like the way they look.
So what is, okay, so, because this all these things like do the same thing. So what is the difference between a wig and a lace front then? They all seem to do the same thing.
It's like same but different.
So it's like a do-rag versus a old school
the
wig
technique,
cap.
the application, yeah. Because even, oh man, there's like a whole world of wigs, like how they adhere to the head as well.
Oh, good
I know.
Lord.
There's conferences just based on this.
I mean, they sell hair by bundles. I mean, now bundles is a word, and
Let's talk about that.
Okay, so wigs and lace fronts, you would or would not advise it, or is there stipulations if you're going to use them?
They can be used. I'm fine with them. I have nothing against wigs, weaves, braids. I have nothing against any type of extension that's applied to the scalp or hair or any unit. We just want to make sure that it's applied appropriately. It's not too heavy. It's not applied or staying in the scalp or to the hair too long, meaning we can still wash the scalp, wash the hair. And it shouldn't be, I always say, too tight, too heavy, or in a place for too long. If you can abide and kind of remove those three factors or red flags, then it's fine to use.
Okay. All right. So let's segue to bundles. Because you was like you had a look on your face when you got the bundle. Look, you are familiar with all this stuff. They might have called it different when you was at Clark, but you're familiar with all this stuff. So bundles.
Bundles. Okay, so when we know better, we do better, right?
Facts.
So we need to understand, like everyone has a weave game on the side right now. Everyone's selling bundles.
I feel like I should get in that. It's $1 million market. I feel like I'm missing the boat
if
on
this
that.
many people's in there and people are still making money, then there's still room for more to jump in. But
Okay, so that was my lead in. All right, everybody. So I'm selling bundles. Nikki gonna hook me up because I know she got a bundle man somewhere. So y'all may wait for the 420 man. I'm waiting for the bundle man. I'm good with that. I'm cool.
Set. So yeah, I mean, so you have to kind of understand supply demand, right? So everyone wants the silkier, curlier, least detangling hair. They want that, fresh, wet look. Everyone wants that wash and go look.
Wavy 56.
Hello. But we have to understand, one, there's only so many heads in this world that we can be gathering these human hairs from.
Okay, so hold on. Are we still... That was slick. So are we still... Myth. Is this a myth or fact? Are we using horse hair?
I think there's probably some combination bundles
Are you
out
serious?
there.
We're using horse hair?
I mean, I have no
horse
proof.
tail?
This is just my opinion.
You get to speculate
This is not
because you're a
fact.
doctor, so you get to speculate.
This is not fact.
So the horse joke by all the bald horses running around here could actually be real?
I think there may be some. I think there can be synthetic fibers. I think there can be animal fibers, and I think there are definitely chemicals in certain hairs. I don't know what companies. I don't know from what bundles. I just know there's a lot of individuals who, when they get sew-ins, they get braids, or they have something that's an extension and it's in close proximity to the hair, they're all of a sudden getting irritation, rash, bumps, allergic reactions, really angry scalp irritation. But it's also kind of like Remy. You remember Remy? Everyone's like, you got that Remy hair, Remy.
Oh,
Remy.
yeah.
So it's not a brand. It's just like the technique of how they're actually bundling the hairs together. So Remy just means like cuticles. So kind of like a Christmas tree, how all the branches come out and they kind of they come out and curve up just a little bit. So if you imagine your hair has cuticles that look like that, they come out and they kind of curve out just a little bit, and then they can smooth down. Remy just means all those cuticles are aligned in the same direction, which means they're not going to, when you comb the hair, they'll be easily detangled.
So that's something like, in essence, saying you got a perm and it straightens the hair out? Is it something like that? Or is it something completely different?
A little slightly to the left. So it's just saying.
Okay, I'm trying to grasp this thing.
Okay, it's like shingles in a roof.
Okay.
So all the shingles are laying one on top of the other, and they all go in the same direction.
Mm-hmm.
Well, if you got one side of your house going in one direction, and then well, the right side going down and the left side going up, that's not going to work, right? So Remy just means all your shingles are going down in the same direction, all your cuticles in the same direction.
You're really good at this. That was a good example.
Thank
All
you.
right, that was a good example. All right,
That was off the top of the head.
It's off the cuff. All right.
So then
all
if
right.
you comb, and your comb will be your rein, that just is everything's going to go in the right direction, the same direction. So that translates into hair, meaning it's not going to tangle up. And it's going to have a nice one surface, so everything reflects off of like a mirror and it shines nicely. So that's Remy. That just means they're all in the same direction.
So are we still using that kind of hair?
I mean, some people still do Remy, yes. It's still out there. However, now, a lot of where everything is created, they've gotten smart and said it takes too much time to put every single strand in the same direction. We're just going to dip this whole bundle in acid. Or something that's going to remove all the cuticles, strip all the cuticles away, so it's just basically one smooth, slick strand. So now no matter if it's up or down, if you've removed all the cuticles, you took all the shingles off, it's just one, it's just roof. It's just a flat surface roof. So all of them are just the same direction no matter what. And then we put a little silicone so we get some slip and some glide and some extra shine on it.
Like silicone that they put in like fake breasts and stuff?
Different. That's you're different.
That's your new word today. This is your new word. It's different as your new word.
I like to
'Cause when
redirect. I redirect.
Because when you use these
softly.
words, I'm just like, okay, I'm thinking what everybody else thinking. So when you say silicone, I immediately think about the stuff that goes into
no different.
implants.
It's kind of like there's like silicone hair solutions, but then it's industrial grade silicone.
Okay.
And so it just kind of coats, but it allows for slick and sheen and shine.
Okay.
And so then that's packaged all up, and it's shipped to us, and then we take it out, and hopefully people are washing these bundles before they apply it to the hair, which is super important, because now if you can imagine, there's chemicals, there's potentially other things, and if you don't take it out the bag and wash it, you have to strip all that off. But then if there's anything in there like synthetic fibers, and you could have allergies to synthetic fibers or potentially animal fibers, that's going to be an issue when you apply that to your scalp. So I always tell everyone, you want to do patch tests, you want to do maybe one area if you can. It's not easy to do that, but if it's a new hair company that you've never used before, you kind of want to make sure you're not going to have allergic reaction before you get an entire head done, and it's in a very static position that's stuck to your scalp. Because that's what happens a lot that I hear. Ladies have to cut the weave out of their hair like within 24 to 48 hours because it's burning and itching, and they don't know why.
So there are certain types of shampoo they should use to wash the hair, or just any shampoo in general?
If someone if they have like reaction on the scalp, or if they just
when you get a fresh pack of bundles.
Ooh, you probably need to do something like a clarifying shampoo. Like some people they'll soak it and then they'll wash it. I mean, you just want to leach out whatever you can leach out. Detoxifying shampoos.
Well,
something.
I mean, I feel like now you saying this, I'm like, is it kind of like when you buy food at the grocery store and you have to look at the label on the bag to find out the trans fat and the saturated fats? So do we need to be going to the groceries or the Walmart trying to find a shampoo that has a 60 pH number or something?
No, it's more like when you get your fruit and you're like, where does fruit come from? Did they use a whole bunch of pesticides on this fruit? So you're probably gonna go wash and rinse that little apple first before you put it in your mouth. Especially if you see a piece of soil still stuck to it, you just be like,
okay, so you just need to wash it before you put it in your hair.
Yeah.
All right, so braids and stuff, sew-ins. How do those work with hair? Are they...
Braids are fine. Again, I tell people if you can try to abstain from doing micro braids, because micro braids will rip out a edge line and frontal hairline quickly. So you just want to be careful with those. But I always say if you can do larger sections when you do braids, then that's better, because that means you have way more hairs holding on to that braid, to the weight of that braid, as opposed to very few hairs holding on to that thick braid. So if it's kind of like if you have more hairs, they're all holding more tension collectively, and they can handle more tension, as opposed to 2 hairs in a 5-pound braid, not going to work. 100 hairs in a 5-pound braid, that's fine.
Okay, so it's a ratio game.
It's a ratio game.
All
And
right,
if you
buddy,
have
y'all see,
fine hair, then you need even more hairs.
That was slick shade she threw out there, but okay. That was some slick shade she threw out there, but it's all right, because that's what we do. Okay, so it's about the ratio. So when they get braids, they want to make sure that when they're getting the braids put in, that they're grabbing more hair and attaching it to... So it's all about not stressing the hair follicles.
Yeah, exactly. You just don't want anything too heavy. And then when I tell people, when you're getting your hair done, if you feel that something's really tight, you have pain, that's your nerves. That's your little nerves saying, hey, something's not right. There's enough getting pulled that our nerves are getting stimulated to say pain. You shouldn't have to pregame and take a Tylenol or ibuprofen before you get your hair done or hair braided. That's not appropriate. So if something's too tight, just tell your stylist or whoever's doing the hair, hey, can you redo that one? Because the unfortunate thing is, I think we kind of go numb to how the scalp feels a lot, and that's a red flag for us. That's a feedback that we should really be appreciative of.
So we should be patting our weave.
You shouldn't be patting your weave. You patting your weave, unless you know you due for a wash, which should be no longer than 2 weeks. There's no reason to be patting weaves.
So these are all myths. All right, so we dispelling myths in this first go round. So patting weaves is a bad sign. That says it's either too tight or your scalp was telling you something.
Now, the random pat is like skin. I always say your scalp's like skin. You can have the random itch, that's fine. But you shouldn't be like constantly going to that same spot, patting, or scratching. Something's not right, right? So the random itch, the random pat, we'll let you slide with that. But you shouldn't like be going to town like 15 times a day in that same spot trying to get to it.
All right, that's one myth we done dispel. So women, stop patting your weave. And if you do, and you pat in the same spot, your beautician should know better anyway. So if she doesn't know better, then that's probably a problem.
That's a problem. However, they're in the best position to be the first line of defense when it comes to hair loss, because you're trusting them, right? They're laying hands on you, but they can see from a bird's eye view everything that's happening on that scalp. They can see your follicles, they can see the density of the hair, they can see the whole hair shaft to see if there's a lot of breakage. So I always tell my patients, who are you going to that's doing your hair? And have you had a dialogue with them? Because that's important. Not only are you trusting them to make sure they're styling your hair appropriately and taking care and having healthy hair, but they should be looking at the scalp too to make sure there's no issues there. Healthy scalp for healthy hair. And for that, we've kind of, at Soka Center, I've worked with and we're partnering with a lot of stylists, trichologists, and barbers. We actually have a class and an internship that can show them, one, how to start the dialogue for hair loss, because it's not an easy dialogue for your clients, because I've always heard stylists say it's hard to talk up to my clients about that because I don't want to be blamed. And so just having that dialogue and knowing what to say and having a dermatologist nearby that can help them kind of navigate through that process is like important. And so our class is online so they can understand and recognize the red flags of hair loss, understand some things that they can actually do for their clients while they're in their chairs, and then when to refer out and who to refer out to.
All right, so we're going to take our first break, and when we come back, we're going to have more of the lovely Dr. Hill on the Leadership Blend with your host, Ricardo D. Rice.
I'm in the right direction. I'm into ride this ocean, traveling in slow motion, paddling with no question. Early morning with the sun, not yet burning, innocent. I try to be a good son, myself 100%. Oh, I feel it inside. I wanna reach that. It's somewhere inside. I wish I reached that. Skyline, skyline. I wanna reach that skyline. Skyline. I wish I reached that skyline. Skyline, I'm gonna reach that skyline. Skyline. Endless troubles to go through. They're strolling in the city. Daily struggle to be true. Betrayed authenticity. poison well around, but still I will take another round or another route until we take off from the ground. I feel it inside. I wanna reach that. It's somewhere inside. I wish you reached that.
All right, everybody, welcome back to this Monday edition of the Leadership Blend with your host, Ricardo D. Rice, and my guest,
Dr. Nikki Hill.
All right, so in the first section, we were dispelling some of these rumors about weaves and bundles and
Oh my.
I know I feel like I'm saying lions, tigers, and bears. Oh my. Weaves and bundles and wigs and lace fronts. All right, so we're going to segue to men real quick because I told Dr. Hill on the break, and I think I said this the last time about a year or two ago when she was with me. I want a man weave. So I want curls or waves. I want curls so, I can be silky when I get out the beach water and, look like I'm on Baywatch. So what about the men and let's talk about terminology. Because I know with men, I've heard the term like skin grafts, Bosley, stuff like that. So how does that work for men? Is it the same concept? What are we looking at?
So the hair grafts are for hair transplants. And there's different types of grafts nowadays, luckily, this time and age. Like the old school were the plugs. They were grafts, but they're just very large grafts, so they almost look like plugs. That is what people typically describe them as looking. They don't do those anymore. Now, when we do hair transplants, there's two primary types. You do a strip method, in which you're taking a little strip from the back of the scalp and you're closing that section off. You take that strip, you cut it up into small little sections, and then you take hairs in groups of 1, 2, 3, or 4. And then it's almost like you're taking flowers from the backyard in a row.
These analogies.
Because,
it's
sometimes...
actually good. It's actually good. I'm just...
Yeah, I like to break it down for the people.
I'm impressed. Carry on.
It's kind of like if you have rows of flowers in the backyard, you take a whole row out, and then you separate out each little flower in groups, maybe groups of 1, 2, 3, or 4. And then you make little holes in the front yard, which is the front scalp. You make little holes, and you put those little groups of flowers in there. So you're taking the whole flower with the root, and you're just transplanting them in and planting them in the front in each little hole. So when they grow, they're growing naturally. They're not clumped together to look like plugs, but they grow as though they were naturally grown in the first place. So they're kind of individualized. So that's the strip method. The individual follicular unit method, or the FUE method, is where you're taking each individual flower one by one by one, just digging each one up by itself. You take that whole flower, and then you, again, just like with the strip method, you plant it in the front yard. So the difference is the FUE, which is the individual, you're taking little tiny dots of hairs. So no stitches needed in the back. It usually heals within 24 to 72 hours appropriately. And then the front, the same kind of downtime, usually up to 2 weeks fully. Whereas the strip method, you have stitches that have to come out in 1 week's time. So that's grafts. And then what was your other? We talked about grafts, Bosley. Bosley is an old school, but they're still thriving and still surviving, hair transplant company. So they are national franchise of hair transplant surgeons. And then the man weave. So the man weave is a unit, or I guess in the world of hair industry, you would almost call it like a topper, or call it a sectional. But because it's the whole scalp, you can just say it's like an adhered wig. Does that make sense?
Yes. So it can kind of be the same thing. It can be like a lace front, or it can be the one that's sewn onto a wig cap, like a wig type thing.
Yes, but the inside of it is usually smooth. Like it will have like a lace lining. There's different kinds, but it may have like a lace lining, and then you're just putting like an adhesive that's going to be on your scalp, and you just attach it and then adhere it to your scalp. And then they'll do like blending if you have surrounding hairs, or if they're doing any of the Beijings or any other like fibers or anything else. But it'll adhere to the scalp. And then if they want, usually I tell patients, if anytime something's adhered to the scalp, you still have oil that's being produced up there, you still have skin that's exfoliating, so you want to be able to wash the scalp and wash the surrounding hair every 2 weeks.
I say, because every time you say something, it's resonating. I'm trying to ask all the questions that people going to want to know. Mm-hmm. So this Beijing thing.
Oh, yeah.
Tell me about this Beijing thing. I tried it. Okay, so everybody that knows me, all my friends and family know when I moved to Atlanta, I was balding. And I didn't want to actually go bald. So I went to the barbershop, and the guy was like, I can fix that. And I was like, really? He was like, yeah, I'm going to give you a Beijing. And I was like, I don't know what that is. I just moved here. And he put all this black dye in my hair. And I went to sleep and I woke up and all this black dye was my pillows, my sheets. Oh, I was so mad. So mad. But now I see that it's taking off again. So now they're putting it in their beards. They're putting it in their, is that good? Is that bad? How does that work?
They have a whole bunch of different flavors now. So now people are doing the fibers. Yeah. So now people are doing fibers, which are like keratin fibers or ground up little hair fibers that match the color of their hair. Or they can do sprays, or they can do dyes, or they can do kind of like how the old school Beijing was. Some people still use that, but a lot of people did start having some irritation. And again, this is a small pool. This is just people that come to me that have allergic reactions to these things. And so we just have to find something that's going to help fulfill their camouflaging techniques without giving them the side effects. I'm not against them. I think they're fine. There's something new on the blog. Well, not new, but something that we offer in our practice called scalp micropigmentation. So if someone uses fibers or if they get any of the Beijings or any of the other sprays, and the downfall of it is once you hit that shower, hit that pool.
Yeah, that's
right.
It's going to change the color of your water. It's going to change the color of your water.
It's like the jig's up. Your game's over, right? But so with scalp micropigmentation, it's a medical grade tattoo system where we're introducing pigment in the superficial layer of the scalp so it mimics follicles or mimics to give someone a look that they're wearing a shaven scalp. In guys or in women, it can camouflage the color of the scalp through the hair so it can give them appearance of fuller hair. So that way, you can still wash, shower, shampoo, swim, any water of any sort, and it's not going to go away because it's actually inside the skin and not on top of the skin.
Huh. Okay.
Uh-huh.
It sounds a lot less. It sounds too complicated. I'll just stay bald. It just sounds way too complicated. I'm good. I'm just good. All right. So let's segue into the types of things that people should look for that kind of gives them the warnings that something may actually be wrong.
Oh yeah. So that's
important. What does that look like?
So that's part of what we say the red flags of hair loss. So intense itching, excessive scaling and dandruff, tenderness, bruise-like feelings, scabs, patches of hair loss, things like that. And I always tell everyone, in regards to symptoms, your scalp is still skin. So treat it as though, skin on your arm, body, face. If you have a rash that keeps going, if you have an area where it always gets sore anytime you touch it, you're going to, after you may try some homeless salves and remedies, if it doesn't clear up, usually you go into a doctor or going somewhere to try to figure it out. So I tell everyone the same thing with the scalp. If you've tried something, a shampoo, anti-dandruff shampoo, and you still keep having the flakes that are building up, something else may be going on, and that's when you want to address it.
What are some common, I don't want to say diseases, but common issues that people typically have as it pertains to hair, like some type of the more common ones, like alopecia, stuff like that. Like, what are the more common ones, and what does it actually mean? Like, let's start with alopecia. Like, what is that? I've heard people say it. What is that?
So alopecia is a Latin term for hair loss. It's just an umbrella term. So it's like saying skin disease. So alopecia just means hair loss, hair changes, hair breakage, hair shedding, hair not doing what you want it to do. It's just alopecia. So when someone says, I got the alopecia, I'm like,
You're like, so
that's
you
like
got
saying,
all of them?
I have the skin condition. But we have to find out which one they have in particular. But in regards to the most common types of alopecias, I would say seborrheic dermatitis, which is dandruff. Everyone has probably had a little wave through that every now and then.
That's not cute. I get bald flakes, which I never thought was possible until I got bald. Like, I didn't think that was possible.
Moisture content is important.
Yeah, actually, let's stay there before you move. Because we're going to talk about me specifically right now. So, with those of us who are bald, because I'm not going to lie, I'm very bad about shampooing my hair until after I shave it. That's not good, is it?
You do want to be able to, because you're still having like all your oil glands there. And actually you have overproduction of oil glands. So you want to make sure you're removing excess oil, because if excess oil is there, then it can feed the natural yeast of the world. So our natural yeast keeps the good and bad bacteria in check. We all have it. It keeps us alive. So we need it. But it feeds on internal oil that we create, and it loves extra oil that we put on our scalp. So we just have to be careful with things that are really, really heavy on our scalp. But for anyone who, whether there's hair or not hair, when we're shampooing, that's really for the scalp. So the scalp needs to be cleansed. Treat it like your face. Are you going to go 2-3 weeks without washing your face?
I'm mad you put me in a spot like that. Of course not. I will, of course not.
I just washed. I got that fresh
not.
wash today.
You look, I got pretty just for today because I knew you was coming out. I was like, she's not going to outshine me on my own show. We've been through this before. You surprised me last time. You weren't going to do it twice. So I made sure I was ready. Plus, you know, I do my TV show after this. So I have to look really, really nice for my TV show.
You gotta look pristine.
You know, I got to look fresh. And you can come and make sure that my scalp is fine. So, you know, come back there, give me the thumbs up. Make sure that, you know, my scalp is fine back there. But, yeah. So we should shampoo it. And then, okay, so another myth, because I'm going to get all these out of the way. For me personally, so when it comes to shampoo, does it matter the texture of the shampoo? Because like shampoos that are really thin, I'm like, this is not gonna work, so I don't even want to use this. So I tend to gravitate towards the ones that are more thick. The shampoo is more thick. Does that make a difference?
So your skin is supposed to be in a particular pH, so it's really more the pH of the shampoo than the consistency. There's just, one, you know, there's 1,000,001.
Yeah, that's what I'm be trying to
narrow it down. Products, and that's the question everyone asks me: what shampoo, conditioner should I use? And I really don't like to get into that per se, more so than the science behind it. So I always tell everyone, you know, you want to be in a pH zone of between 4.5 and 5.5 with your shampoos and conditioners. And your shampoos should be a little bit more acidic, a little bit more basic, meaning the higher number, than your conditioners.
Is that on the back of the bottle?
Not always, and
you're killing me. You're killing me, Doc.
But you know what? I always tell everyone this: if you like, now it's two answers to that. If someone's, if we're talking about for their hair and healthy hair care, then I just tell them, how does your hair feel after it? If your hair feels soft, it feels manageable, it feels moisturized, then you're in the right zone, and you know you're using the appropriate shampoo and conditioner for yourself. But if it's really dry, if it's brittle, dry hair is fragile hair, if it's, you know, doesn't hold its luster or other things going on, then we need to switch around and change things up. For scalp is skin. Skin needs its right pH zone. So I just say 4.5, 5.5. And if you really want to go and be a scientist behind it, you can go get some pH strips, you know, and just dip it in the bottle.
Am I supposed to dip that on my head or what? Because I can walk around with it taped to my head until it changes colors. Because, you know, I work in fast food, so I know that you dip it in there, it's supposed to turn a certain color. So, I mean, I can do that. If that's what you're saying to do. That's what you're telling me. Like,
no, and I tell everyone, you know, shampoo strips oil, and then your conditioner has to moisturize. So your conditioner's like the lotion. So let's talk about that for a quick second, the co-wash method, because in a natural
I feel like you're about to
world,
bust me real good, but
I'm not gonna bust you.
I feel like you about to, because I feel like I'm gonna fall in this cat. Whenever you get ready to say, I feel like it's gonna be me. I just got that feeling. But go ahead. I just feel like it's gonna be me. But go ahead.
No,
go ahead.
It's in the natural hair care world predominantly, but I think it kind of got into the masses. But co-washing is when someone will, instead of using shampoo, they'll just use conditioner to quote unquote wash the hair and rinse it out. Now, the purpose behind that is they'll do the conditioner because it's moisturizing, it allows for slip and glide, it softens the hair, it closes those cuticles down. That's what conditioners do. So it kind of helps with detangling and such. The issue with that is you can co-wash, you know, randomly, but you don't want to continuously co-wash because it's like if you got in a shower, you put lotion on your body,
Yeah, that sounds gross.
and then you rinse it off and you got out. Guess what? All that dirt, debris, skin cells, it's just hanging out.
Why
on
you gotta
your
keep
skin.
doing something?
I'm sorry. I just want to make sure the people have the knowledge. Because when we know better, we do better.
Okay, so like you said, okay, so the shampoo is what cleanses the scalp, and then the conditioner is supposed to re-moisturize it.
Yeah, shampoo is really for scalp, conditioners for hair.
So can you do a 2-in-1?
Not the best.
See, that's what I was talking about. That's what I do. And it says 2-in-1, I buy it. I was like, good, so I don't have to shampoo.
Now, you could probably do that. You could get away with that.
It.
Yes,
okay, cool. I
that's
just want to make
fine.
sure. But for people who have hair and man weaves,
yeah, sometimes the 2-in-1s may not give you the best of both worlds because you're compromising. Yeah.
You had to use that word. Like now, you really make me feel better.
It's being functional. It's functional. There we go.
Okay, fine. Okay, that hit home, but fine. All right. So we should actually shampoo and then condition.
Absolutely.
To make sure that we have good hair.
Yes.
Okay. That don't apply to me because I'm bald.
You got to moisturize. So you shampoo. You can condition the skin or you moisturize the skin, whichever you prefer.
But if my scalp is singing after I'm done, I'm on the right track.
Absolutely. If there's no dryness, no itching, no irritation, then you're fine.
But that means I still need to shampoo and conditioner because even if I just shampoo it, it still looks dry up there.
Yes. If you have some dryness, then you need some moisture. It's like if you get in the, you know my analogies. Now, if you get in the shower.
Oh, Lord, here we go with these analogies.
Don't hate. Now, if you get in the shower and you get like a harsh soap, like Irish Spring. You get that squeaky clean feel.
Oh,
In
I hate Irish
5 minutes, you're going to have a layer of flour on you. It's just the ash is going to be so serious. But so you have to moisturize whenever you have something that strips oil. That's what shampoos and soaps do. They strip oil. They remove oil. And so by doing that, you've removed your oil. So now you got to re-moisturize. You need to replace it.
Okay, fine. I'll give you that. That's
Thank
fine.
you.
I'll give you that. Fine. Fine. All right, but then that takes me back to something we talked about previously. So when it comes to women with weaves and stuff like that, virgin hair, what does that mean?
Virgin weave?
Yeah, like virgin. They be like, oh, I want some virgin weave, and I see that people who sell weaves make sure they highlight. Oh, we got virgin hair over here. What is that about? What does that mean?
It's supposed to be unprocessed. It's supposed to not have had relaxers, perms, colors, or anything like that.
Is it better? Or is it supposed to be better?
In essence, I guess it should be better because it technically shouldn't have undergone any chemical processing, where you may have allergies to it.
How's that benefit? Like, if it hadn't been straightened or anything like that, how's that?
Because the cuticle is going to be nicely aligned. So anytime you do color, chemical processing, relaxers, perms, anything that's chemical based, a lot of times it could damage and disrupt the cuticles. And so if your cuticles get chipped off, like the roof, the shingles on the roof, you pull off a couple of shingles, the function of it is messed up. Now the water can seep through where the shingles are missing. But it's the opposite effect of hair. Those shingles are keeping the water inside the hair. So now if you break off shingles because the chemical processing, the water's going to evaporate out of the hair, and the hair's going to be dry. Dry hair is fragile hair. Oh. And nobody wants their weave to start breaking up.
Yeah, that'd be quite embarrassing. See, this all makes sense. Not you explain all this. Now this explains the hair I be seeing. So when they have the long bundles, that could be virgin hair. Because it's just straight and long, and they just, they want to do the Sassoon commercial, and they swinging their weaves all over.
Potentially, yeah.
I know that look. That's a no. Okay, I know that look. That's a no.
It's the hang time, It's the hang time that sometimes the longer it is, the more I'm like, what has been done to it. But, I tell everyone, as long as you're not having itching, tenderness, irritation, when it's applied, you're fine.
All right, so let's go back to the disease thing. So alopecia is like the umbrella. So you can't actually have alopecia. It's kind of saying I have hair disease. It's just a vague statement.
It's very vague. So you always want to get a very specific diagnosis so you know exactly what we're treating and how best to treat it. But one of the most common types of alopecia is the seborrheic dermatitis, which is the common dandruff. Cradle cap in adults is how I always explain it. I don't know if people have seen cradle cap, but usually babies kind of get that little caked up, yellowish looking scale on their scalp, sometimes around their eyebrows, or
That's
on
what
their
that
face. Mm-hmm. It's just natural yeast that just kind of overgrows a little bit, gets a little extra love.
Extra.
Yeah.
I'm not even going to just keep going. I'm not even
and
going
then,
to touch that.
but it happens in adults, and it's usually on the frontal hairline, around the eyebrows, around the ears, around the nose. So that's super common. And unfortunately, a lot of the over-the-counter things and some of the prescribed things sometimes are a little harsh on the hair because they're focusing on scalp and not necessarily on hair. And so same thing with shampoos that we were talking about. Sometimes when they're really aggressive on the scalp, they're really drying and irritating, or not irritating, but drying to the hair. So it's always a fine balance in that pH zone. But that's why we created, or actually I created the SOCA formula, which is a 2-step process, really just a pre-treatment for seborrheic dermatitis or dandruff. And I'm talking about that irritating dandruff that just kind of persists. You can't go a week between washes because the dandruff keeps building back up. It's for that particular type of dandruff or dry, itchy, flaky scalp. But it's just a pre-treatment. You put it on dry scalp, leave it on for 10, 15 minutes, and then rinse it out. And then you do your regular shampoo and conditioner. So it doesn't interfere with your routine regimen.
Okay. So, I'm trying to think if there's any myths about dandruff.
Oh, yes. Oil in the scalp, grease in the scalp. People say, oh, it's dry. I need to put more oil in. Well, you're just feeding the yeast. You're just adding to the party.
Okay, so wait. That's... Because like I said, I get ball flakes. So me putting lotion on my scalp, that's not helping?
Lotion's okay, because lotion is water-based.
So wait, I can put lotion on my scalp?
You can. It's skin. That just blow your mind?
Yeah, yeah, you kind of did because it's like skin with a lot of hair on it. So, the ideology, because I always thought I should not put lotion on my hair and I should find some kind of grease or cream or something to put on my head.
Some thick salve.
Yeah, I told you, if it's not thick, I don't want it. So that's what I felt. But
That's
now
just-
you telling me, because you know I use Pond's. I have to have that good stuff because I get real ashy. So I use Pond's. So you tell me I can put Pond's on my scalp and I'm good.
You can.
Huh.
You can.
But what for females though? So that is not true for females.
It just depends the barrier. Now, if someone's wearing their hair longer, then that's going to be an issue because, of course, the hair is going to require something different. The scalp itself is skin, and so just how you would hydrate skin elsewhere, I tell people you can hydrate the scalp the same way. Now, and I'm not saying go buy a bottle of detergents and throw it on there. I mean, if you have it and you're wearing a shaved scalp, that's fine. But in regards to moisture, and especially with the hair itself too, grease and oil has very little to no water. And how do you wet something up? How do you hydrate something? You got to throw water on it. So if you're putting something that is basically water resistant or waterproof on top of dry skin or dry hair, you're just locking
like
in
lotion
and sealing in.
In the shower thing. The same thing?
Yeah.
Come on, nigga, tell me I'm right.
Yeah,
Tell me
yeah,
it's
yeah.
tell me
Oh,
the
he
same
got
thing.
it like
yes! Field goal, whatever that means. I know how to do sports.
Yeah, but it's true. Like, it locks it in. So that's
It's like putting lotion on in the shower because now it's all gross and thick and nothing's getting out.
yeah. Because I say, you know, those little when people have the salad dressings and they have the oil and the vinegar.
Yes.
And the vinegar, you can say, is water, basically. They're not going to mix. You can shake them up, and they'll,
this is
like,
true.
try to, you know, create little micelles together. But then once they settle, they're going to separate out. So if you put a thick layer of oil or grease on the hair or the scalp, and you put it on dry skin, you're just sealing in and locking in dryness. But if you put it on moisturized skin, at least you're sealing in moisture, but it's not going to be for long. And so if someone when people tell me they have dry hair, and they're putting oils on, I'm like, well, it's going to still be dry because you're not putting any water on there. So I like serums, lotions, water-based products, which are bringing the water and helping with hydration. Now, that's a whole different world if someone's wearing a pressed out style and they're natural. They know what I mean. We can't really deal with too many lotions. However, there's always a time and place.
On that note, we're going to take our next break, and when we come back, we're actually going to talk about natural hair, because I actually do want to have a little discussion about natural hair, because that seems to be the new in thing.
Yeah.
So everybody stick around the Leadership Band with your host, Ricardo D. Rice.
Somebody tell me the answers. Me and you isn't the answer. Me and you isn't. Maybe I'm telling myself that, but there ain't nothing that'll change that. What good would it be if I knew how you felt about me? Yeah. It could have been right, but I was wrong. Only think about you and I'm alone. Part of me that cared is gone, and I know that I can't get caught up. We could have been, and we try to pretend every now and again. We don't dream about, don't think about what we could have been. No, I'm holding it in, 'cause I know in the end, you dream about, I think about what we could have been. We could have been, we could have, damn, yeah. Remember the night in Miami, first time you put your arms around me. I'm up reminiscing, yeah. And thinking about you isn't helping, thinking about you doesn't tell me what good it would do if I decide to face the truth. It could have been right, but I was wrong. I only think about you and no. You only hit me up when she's not home, and that's why I can't get caught up. We could have been, and we try to pretend every now and again. We don't dream about, don't think about what we could have been. Oh, yeah. I'm holding it in, 'cause I know in the end, you dream about, I think about what we could have been. We could have been. We could have. We could have been. We could have been. We could have been. Yeah. we could have been, what we should have been. If I wasn't with somebody, if we gotta hide it, what's the point of trying? I ain't just your friend, no, what's the point of lying? Trying to sell a story, ain't nobody buying. Look me in my eyes, don't that feel nice? Why should it end? Baby, I could've been him or your friend. Just say what and when, where to make a trip. Baby, make a wish, be the one I'm with. Should've been a, shoulda, coulda, would have been. Hey. Yeah, I would have been. Damn. Yeah, I would have been.
All right, everybody, welcome back to this Monday edition of the Leadership Blend with your host, Ricardo D. Rice, and my very special guest,
Dr. Nikki Hill.
All right, so those that have been watching, we're in the second hour, and Dr. Hill just embarrasses me every time she comes in, and it's okay because I don't like to be ignorant, so it's okay, and I'm bald, so I don't really have to deal with a lot of this stuff because I'm bald. But so we've touched on a lot of things that pertain to weaves and man weaves and bundles and all this terminology that we've come up with. Now let's segue to natural hair because that seems to be a whole new creature. And in my day, you really didn't do natural hair because it just wasn't the thing. Now it seems to be all the rage. Oh, yeah. So let's talk about natural hair.
Well, now we have products. Now we know how to do that thing.
Was that the issue before?
I think that may have been a little bit of the issue because, we didn't know the curls that were within the comb out or the blowout. And I think that now that there's a lot of curl definition, that's like curl definition game out there that's serious now.
Oh my God, that's a thing? That's a new term we doing?
Yes.
Oh my God, I thought it was pattern. So it's not pattern now, it's curl definition. Are you free? I feel like you just made that up.
You know what? It's okay. No one's ever going to know.
I feel like you made it up. Is that a real thing? I feel like you made it up.
Defining those curls, that's like all the rage.
What does that even mean?
So you can have someone that has natural hair, and if they detangle it and comb it, it can have, it's just the confirmation of all the curls. So if you comb, and all the curls are not really organized, like the shingles on a roof, it's like if you threw all the shingles on a roof, but you didn't line them up. You just kind of put them all next to each other and just kind of spread them out, but they're not all aligned. That's what happens when you just curl out natural hair. It just, quote unquote, frizzes up, but it just is not aligned. The curl defining is when you put all those shingles in the same row, you put all those curls in the same pattern, and you just got that serious like S wave or Z wave or all kinds of waves going on.
So, God, y'all in this wave thing.
I know, it's a whole world of natural.
It's like a whole other thing of terminology.
It is.
And did you learn this stuff in school? You had to learn it when people came in.
Oh, honey. They didn't have this one. Well, no, I guess they did have a little bit because I started going natural in residency and then jumped off the ship and then back onto the creamy crack ship, and then I jumped back into the natural ship. So I've been natural now for about 3 years. But then there's different grades of natural. I'm one of those naturals that press my hair out all the time.
Really?
Yeah. So this is pressed out. And then there's naturals that don't use heat at all. And then there's naturals that don't use heat or color. And they're like all natural. So it's different levels of natural within natural.
Your hair is always throwing because your hair is like, it's like the perfection of black hair. It just looks like...
Oh, well, thank you.
I mean, it should be because it should be. But I mean, I don't know.
It's my brand.
Exactly, pretty much. So, but your hair is always, the texture of your hair always looks like you have the baby hairs going around the edges and stuff.
Don't you say those words.
You got the baby hairs and stuff going. But I mean, I don't really see, and yours is natural. Mm-hmm. Like, this is your natural hair, the pattern of your hair.
Well, I had a flat iron to it, so it's pressed straight.
So with your hair,
otherwise it'd be curly.
I don't think I've ever seen a picture of your hair like curly.
I have to pull it up on Instagram. I had it done once. It's a
Only
lot.
Once?
Only once. I strive to go back to it. It's just I need something quick to get up and go in the morning.
What I mean, does it? I have to ask my cousin what that looks like. I mean, is it? I can't see you with like really like tight curls, or it's like long.
Yeah,
curls?
they're like tight curls.
Really?
Yeah, it's like a little curly Sue afro. It's cute. It's really cute. It's just it feels heavy because there was so much product on it.
Oh, so you have to, but this is light, so you don't have to put anything in this.
Not much on here. Mm-hmm.
Oh.
I just put a little serum every now and then.
But you can throw water on your hair.
If I throw water, I'm one of those women I was talking about. I throw water on this, it's gonna revert and shrink up.
So when it rains, it does that. If you get caught in the rain,
sugar melts in rain is what I say. So this hair doesn't get around humidity. This hair is constantly tied up If it's a shower, if it's a misty day, mist is the worst. I can handle full out rain, but mist goes everywhere.
Oh, I guess that
So
is
yeah,
true.
this is always under her hat when it's outside.
I'm so over you right now.
It's like
I'm
real,
so over you right
real
now.
talk. Natural struggles.
So people that have natural hair, does that require more product because it's natural, or should they use less product because it's supposed to be natural?
It depends on their hair, and I think that's the most exciting and difficult and frustrating thing about natural hair. It's basically relearning everything. At least for me, it was relearning everything that I learned on my relaxed hair. I had my relaxed hair game down great. And then I started going natural in residency, and much like many of the people, I went to YouTube. I said, YouTube, teach me
really
YouTube.
go to YouTube?
Yeah, I was like, teach me
Oh,
YouTube.
good Lord.
And the concept is I would look at someone's hair in the video, and I go, okay, I want my hair to look like that.
Oh,
and
good
so I'd buy all their products. And I go home and use it, and I'm like, my hair don't look like that. It didn't work.
I didn't get this. I didn't use the same results.
But it's just all about going and making sure. Now, this is where it comes in when you're asking about the thickness of products. Natural hair is low porosity hair, and porosity, that's a whole game in natural hair too.
You got the, I don't know what that means. So
porosity. So let's go back to those cuticles and the shingles on the roof. So if the shingles are lift up, well, if all the shingles lay down nice and flat, then that's going to be high porosity hair, which means they're usually more moisturized. They can moisturize easily, but moisturize easily. If the shingles are lift up and raised up, water's going to evaporate out. Water can get in easily. Water can leave easily. Right? Not the best analogy, but kind of, right?
I kind of get
so
you. I kind of get you.
What happens with low porosity hair is those cuticles can open up easily. When they open up, that's when you can hydrate. You need to seal them down. But unfortunately, they'll try to keep opening, and you can evaporate the hair out, and the hair becomes dry. Dry hair is fragile hair. So that's why a lot of times when ladies are natural, they're still trying to use products when they had relaxed hair, which changes your porosity, makes it more highly porous hair, which means they can moisturize easily, hold moisture easily, but they're low porosity, so they need extra moisture. So a lot of times ladies will start using thicker agents, but in reality, you kind of need something more watery to bring the water and moisture to the hair. So with my ladies that come to me and they have breakage or they have dry hair, I'm kind of going through a Rolodex of what products they're using. Because if they're using something that's heavier, something that's greasier or oilier, because we got the butters, we got the whips, we got the souffles, we got all these delicious sounding products
that
now.
sound like food. Was that product? That sound like food. Like
it's a whole world of them. But if they're too heavy and too thick, you don't want to put that primarily on the hair. You want something that's more water-based touching the hair first, because we need that water and that hydration to come in. As opposed to something that's thicker and heavier is going to put a barrier between your hair and the humidity and moisture. You need that humidity to help rehydrate the hair. But if you have a thick barrier between that, you're not going to hydrate the hair very easily. And so with patients, when they have low porosity hair, that's where the pH is more important. That's where water-based products are more important, so we can hydrate.
that was a lot.
I know.
I need you to simplify that. So what you saying? Like what you saying for natural?
If you're
hair?
natural and you have low porous hair, you need water-based products. If you want to seal in, which sealing is very important, and that's big in the natural game, seal after you have water on the hair. Seal after you have hydration on the hair. Seal after you have something that's watery or lotion-based on the hair.
Okay, for all people that are natural, y'all know what that means. I don't. So for all people that are natural, y'all should know what that means. I don't know what that means. So yeah,
You want me to give you an analogy?
I was waiting for you to get. Normally, you already have one on deck, so I was a little disappointed that you didn't immediately have one.
Well, let me get one right.
So
for
you know
y'all.
that's.
So fresh out the shower.
Okay.
Just turn the knob off. You still have water on your body.
Mm-hmm.
If you were to put oil or Vaseline on your body, then
Ugh.
you're sealing in the water underneath
Wait, have I dried
that
off
layer.
yet? I'm just putting on top of the water.
before you dry off.
Ugh, so I mean, I'm putting Vaseline on water. Like, is that really where we going with this?
You're sealing in the moisture in the skin.
This is gross. This is gross. Is it really where we're supposed to be going? I don't feel like this is where we're supposed to be going.
You said I made a left turn somewhere.
Yeah, I think you made a left turn somewhere. This is gross. So, what you saying?
That's all I had. I was trying to
Well,
say.
try
if you
the
put-
plant thing. The
if you-
plant thing was nice.
The plant?
Yeah, we tried the plant thing.
Let me see. How do we seal with a
Oh,
plant?
throw in some rabbits. I like rabbits. Throw in some rabbits.
Oh my gosh.
I'm just saying. I need you gotta simplify that. Like I did that. Yeah, that didn't.
Let me see.
I mean, the out the shower thing works. It's just
Okay, well, do the flip of that then. So, say if you dry off completely and you put oil on,
okay, like baby oil.
yeah, you may feel moisturized, but you just put it on dry skin. So whatever's underneath that oil is locked in. So if you put oil on dry skin, you just have dry skin underneath. There's no
Okay.
moisture. You put baby oil on top of wet skin, then you trap in whatever's underneath the baby oil. So if you put baby oil on top of wet skin is underneath. Hydration.
Okay,
So let's pull that over to the hair.
that was a better analogy. I can follow that one. That was a better one. I can follow that one. I can follow that. Okay, so wait. So if it's water based, then it's covering both
Yes.
things. So you want to get
Yes.
water based. See, your analogy worked. That made sense to me. I got that because that when you were going with the that was a little gross. And that makes sense to me.
That's the treatment we do for eczema patients.
Oh, good grief.
Oh,
That's
the little dry babies. We have to hydrate them.
actually that's a very good question. So is eczema a hair thing too, or that's just because hair is skin? Or
You
said
can
hair
have
is skin.
eczema in the scalp. Yep, you can have eczema in the scalp. You can have allergies to your products on the scalp. You can have psoriasis on the scalp. Because unfortunately, two things happen. When that builds up, it causes inflammation in the scalp. Scalp is simple. Fight inflammation, grow hair. So if you have eczema that's creating inflammation, you're not going to be able to grow hair appropriately. Same thing with psoriasis. Same thing with sometimes dandruff. Or what happens, people scratch because it's itchy, and that mechanical scratching can damage and break those hairs. So that can also lead to hair loss as well.
Wait, you use the term. I don't know what that means.
Which one?
Psoriasis.
Psoriasis. So psoriasis is a skin condition that can happen in the scalp or scalp is skin. So it can happen on the scalp or it can happen anywhere else on the body. It's when your immune cells start going into the scalp, but then it makes the skin super, super thick. So usually people get like a white, thick layer of just dead skin cells that don't exfoliate off. So usually people get on their elbows or they may get on their knees or they can get patches on their body and scalp.
So anything that you could get on the skin, you can get on the scalp. In essence.
There's a potential, yes. Not all of them, but there's a potential.
God.
Just open up a world.
I know. It's just like, oh, okay. All right. So let's say that somebody decides that their issues that they're having have been going on for too long, and they decide to see a dermatologist. What are some things they should expect?
So one, I always tell everyone, time is follicles and early detection is key. So the longer you wait, especially if it's something, whether it's a reversible process or irreversible process, the longer you wait, the more likely we may not be able to salvage all the follicles and hairs. So it's super important to try to find someone, a dermatologist that specializes in hair loss disorders early on in a process of either feeling symptoms or seeing hair changes. When someone comes to me as a patient, we're going through the whole hair journey, their history. We're looking to see if they had any issues in regards to their diet changes, stressors. We're looking at what their day-to-day lifestyle is like, if they're exercising, what products they're doing to their hair, hygienic products, or styling methods they're doing. So that way we can really get to the bottom of it. Sometimes we have to do blood work. Sometimes we have to do biopsies to really see what's going on in the full scalp. Because I can look at the scalp. I can use a scope or a dermatoscope or trichoscope to look at the scalp, but sometimes things are happening below the surface of the skin. So that's where a biopsy can come into play, which is where we numb up the scalp, we take a little sample, send it to the lab, and we close it up with a little stitch.
So you're a doctor.
Oh my goodness. I got that.
I mean, you gotta do all this, and you're a
got
doctor.
that MD.
Well, I mean, okay, so I will say in the African American community, dermatologist is not a word that we typically use. Like I don't think.
I didn't know a dermatologist was actually a doctor of hair, skin, and nails until I went to med school, and it was probably my second year of med school. So I understand.
See?
I know.
So why you give me that look of disgust when I said that? Like
you
was
was
like a
like
look of disgust that you gave me. Like
I got my Google MD or something. You was like, oh, you a doctor.
Well, no, because again, most of us are not familiar with the dermatologist. We kind of throw it around.
Yeah.
But unless
You're
you
right.
have like something serious like on your face or something, and you're recommended from a hospital
I
to
agree.
go, we don't think about it. It's kind of in our community. It's kind of like It's kind of like the word chiropractor. You don't really think about a chiropractor.
Yeah.
It's kind of like if you get an accident, then yeah, you need to go to a chiropractor.
That's the
but
first word you learn.
Exactly. When you get an accident, it's like, yeah, you need to go to the chiropractor. But out of the gate, it's not something you think of. It's like a luxury. It's not something you really think of. So, the fact that you're a dermatologist is...
Yeah, there's not that many dermatologists in U.S. And then those that actually specialize in hair loss disorders, there's a handful of us. And we all know each other. And there's actually a website called docs4hair.org that one of my colleagues, Dr. Osai Tutu, created. So that way, if someone's, whether they're in Atlanta or in other states, Georgia or other states, if they need to find someone that specializes in hair loss, because it's important to go to a dermatologist that specializes in hair loss disorders to really get an accurate diagnosis and develop a treatment plan.
Jesus, it sounds really... You know my nerves sometimes. You do it. Love you so much. Come here. All right, so protective styles. What does that mean? What does that mean?
So protective styles is a technique or method in which when someone has a protective style, they're having little manipulation. So they're not having to detangle or comb the hair on a daily basis. They're able to hydrate the hair appropriately. They're able to not use heat. And they're able to kind of allow the hair to be in its natural state away from triggering elements that can lead to damage like heat, friction, combing, brushing, things like that. So in essence, they can be a positive and a very good thing for natural hair.
So a protective style is like a wig or a weave or something? Is that a protective style?
It
or just
has
like
been
hair?
in that can be used as a protective style if it's applied appropriately, and those same three things: not too tight, not too heavy, and not in place for too long.
Okay.
It becomes not protective when someone leaves that style in for longer than 2 weeks and their scalp is not getting any cleansing. It's not protective when they put a wig on or sew-in on and they don't do anything to the hair underneath for a long duration of time. It's not protective when they don't moisturize the hair underneath because your hair is still there. So I tell everyone, even if you're wearing a wig, a weave, a sew-in, braids, however, you still want to make sure you're still hydrating the hair, cleansing the scalp, and you're able to, nothing's too tight, too heavy, or too long, or in that style for too long. Because if you don't cleanse the scalp, cleanse the hair, and hydrate it, it's going to become brittle, dry, is going to have overgrowth of yeast, or you could develop bacterial infections. So you really want to still take care of the scalp because it's still skin. It's like if you wear a mask for 3 weeks, you still need to take that mask off and wash that face, and then you can put the mask back on.
That correlation you just made was classic you.
Yay.
Classic you. So there is a proper way to wear a wig or a weave. Like you should have it, but for any style, no longer than 2 weeks.
I tell people, and then they're like, blasphemy. But, because they like bought it, right? They bought it. They paid someone to put the style in. But you just got to be careful. If you start having a lot of itching, a lot of flaking, a lot of dandruff, and the hairs need to shed out. So if the hairs are braided down for a month, they're not going to shed out appropriately. And then people get a little nervous and scared when they see a whole bunch of hair shedding. Because you're going to shed about 100, 150 hairs a day. Multiply that times 3 weeks. People get really paranoid.
You try to make me do math?
No.
I feel like you try to slick throw some math out there. Like I don't.
And that's why I didn't say equals 2. I just said just process that. Think about that. Let it marinate.
So we shed that much hair, typically. Mm-hmm. But is that hair we can see, or we just see it when it gets collective?
So like it's the random, few hairs a day that you'll pull out. It's the random, hairs when you comb your hair or wash the hair. But when someone has a protective style in which they're not detangling or combing through the hair, if they're going a week or 2 weeks or beyond, that's when they get the ball of hair. That's when they have a collection of hairs because they're not able to shed out.
So combing your hair is important. Combing and brushing your hair consistently is important.
It's important. At least finger detangling frequently, so that way you can remove those excess hairs. Because if someone does not allow those hairs to shed out, they're dead hairs. So if you try to wash your hair with all those dead hairs hanging in there, you're quickly going to have a matted, knotted mess.
I was actually thinking about that word matted. That kind of came to my head. So let's segue to non-melanated hair.
Okay.
So, because is all this the same for? Because they wear weaves too. People who are not African American, they wear
extensions.
weaves.
Yeah, tape-ins, clip-ins. Yes, I've seen full. Yes, I've seen lace fronts as well. Yes, I think with individuals who are actually, I guess just anyone that's not African American who I've seen have issues with extensions is they had either allergies to the tape when they were tape ins and adhesives, or they were having the extensions were too heavy on their hair, so it was either breaking their hair or pulling it out, and they would end up getting traction along their scalp where those extensions were located. So it's the same concept as what we mentioned with braids. You want your extensions to be able to, the extension has to be small enough and light enough if it's going to be on few hairs, or you need to have more hairs if it's a heavier extension, or which usually equates to a longer extension. So you just have to be mindful, again, how does the scalp feel? If it's itchy, if it's painful, if it feels like someone's pulling constantly, then that's a red flag that you may need to change up the style.
Okay, so it's kind of across the board, kind of collectively, the same ideologies. That it shouldn't be too heavy, all that good stuff. All right, so because everybody's gonna kill me if I don't get some good stuff. So, good points for wearing a weave. Like, when should somebody consider getting a weave, or do you lump these all together, or are they all different? Like, do you say weave versus bundles versus lace fronts, or are they all kind of lumped together?
I just say units. I say units or scalp pieces in my practice, and then they just tell me like what they do, because I'm asking them, what do you do on a day-to-day basis, and what do you do at night? And so some ladies say, I wear a wig during the day, or I wear a unit during the day, or I wear a lace front, or usually they have names for them, and they'll have them on the stool or on the chair, so I already know who's here.
Are you telling me that people?
Yes, that's a real thing.
I'm not about to do this with you today. Are you telling me that people?
I brought Amelia. No, but they usually have foxy names. They usually have like really foxy
I blame
names.
Tamar Braxton for that, because she started naming her wigs, and then all of a sudden everybody started naming wigs.
Well, then there you go.
Yeah,
they usually have like really foxy names. It's like their alter egos.
Like what? Because I know you got one. I know you got one good one.
Like there's always like a Veronica.
Oh, good. That is not a sassy Veronica.
I don't have a good one.
That is not a sassy
That just came off
name.
the top.
Come on now. I know you got some good stuff. Like
I
need to entertain the folks for a quick second.
Oh,
I know you got a good one, like
I don't have one.
Foxy Cleopatra or something. It's for the older ladies that come in with their units.
I'm sure there's been one.
You got to remember
I'm
at least
sure
one
there's
or two.
one.
You're so fired.
No, someone did say Foxy, but I don't know about Foxy Cleopatra, but that would probably be a cute one too. I don't have one. I'm sorry. Oh, fail.
Oh my God, you're fired.
But so once I know exactly what kind of unit they're wearing, then we just talk about how they're doing it. Because if I see they're trying to cover an area that's in the crown that's thinning out or has inflammation and scar tissue there, and I see they have a full frontal hairline but it's starting to thin out in certain areas, then we're talking about changing that up. But I also make sure they have like a trichologist or a wig specialist that they're seeing as well, so that way they can kind of guide them around. There's a lot of different ways to adhere a unit to the scalp, and so if someone has issues along their edges and that they're using clips, then we want to switch it up to something different for them. We don't want to cause insult to injury.
That was a nice throw-in. All right, so we're going to take our last break, and when we come back, we're going to dispel some more myths and get down to the nitty-gritty with the doctor here on the Leadership Blend with your host, Ricardo D. Rice.
I was born a water baby, swimming with these times, the grooves that turn the gray to sunshine. 'Cause I will live through days that break me, swimming with these times, the grooves that turn the gray to sunshine.
I'm still trying to write the story as I see it. The trouble is when I say it, they don't believe it. They reckon I only say it, but I don't mean it. I'm trying to tell them I only say it if I can feel it. 'Cause money's tight, maybe tighter than it was before. I'm helping out on a mortgage I really can't afford. Family breaking north, I covered the trips abroad. Shaking up, making another loss on another tour. But what I done it for? To see my mother in the sun abroad. I run in the trouble that was coming for. My little brother got the hunger for. All the exact same pain that makes the rain in my stomach pour. So let me paint it broader. This for any dude who's got a daughter, living off lines like your papa taught her. Ain't got no time to be coming for you. Go with the flow with this, run the water. Go with the flow with this. Go with the flow with this. Go with the flow with this.
Don't you worry, two leaves won't grow the same, and people might forget your name. Doesn't matter if they do. Don't you hurry, when the hot coffee pours will stain, and when the Uber left you in the rain, your time will come around to you. Despite the stress of spending so much time alone, 'cause this geography is keeping me at home when I don't know the way to go. I move with the flow of this running water, this running water. 'Cause I was born a water baby, swimming with these times, the grooves that turn the grey to sunshine. 'Cause I will live through days that break me, swimming with these times, the grooves that turn the grey to sunshine.
Go with the flow with this from the water.
All right, everybody, we are back on this Monday edition of the Leadership Blend with your host, Ricardo D. Rice, and my very special guest,
Dr. Nikki Hill.
All right, so we be cutting up in here on break. So if you're not watching the Facebook Live, then you're missing it because they get to see us cutting up in the studio. But it's always a good time when the doctor comes in because, you know, I'm trying to wrap my head around doctor. Like, I like to call her doctor, but every time she talks, she's like, she's a real doctor. Like, so I told her that she has to make a video where she's like, scalpel, I need 3 cc's of skin grafts, like something like that, so that I can see her in action with the white coat on. You have to have on your official coat.
I'll get the embroidered one.
Does it say Dr. Nikki Hill?
It says Dr. Nikki Hill, dermatologist, medical hair expert.
I love it. This I love it. All right, so go into what you were saying, like not the skin cancer thing, but the aesthetic thing.
Oh, aesthetic. So that kind of goes back to, personal branding. So I always tell everyone we just want to polish, keep things looking very nice. Sometimes we need a little tune-up over time. So with that, a lot of my hair patients will turn into skin patients, which I did do training in cosmetics, aesthetics, and routine general dermatology as well. So some of the things that we do in there is just kind of creating skin regimens for people, depending on what age group they're in, and just customizing it to them. So sometimes patients want to just have straight natural regimens, so we'll do natural regimens. Some people are fine with combination or traditional regimens or traditional medications. So we just kind of find out what's appropriate for them. And then in regards to like aesthetics and cosmetics, like we'll do fillers, which is kind of a gel-like collagen-like substance.
Really?
That's for volume. So you have fillers and Botox, or really neurotoxins. So Botox, Xeomin, Dysport, they're types of neurotoxins. So everyone always gets confused what is what.
I about to, did you see the look on my face? Like, immediately I was like, I don't.
So fillers is kind of like Plumping up is for volume. So it's kind of like think we're a balloon and we're deflating in certain areas. People sometimes deflate under the eyes and get dark circles. They deflate in the temples. They can deflate and they can get lines along the sides of their mouth or sides of their nose or around the corners of the mouth. They can deflate and they can have folds. So some people don't like that. And so we have to inject filler in those areas so we can plump it up and give a little more volume.
Okay.
Now, not scary looking, but I like to go natural. So that way we just kind of give a nice polished look. So if someone has like dark circles in the eyes, filler is a good treatment for that area. But so I always tell everyone, we want you to look the next day when you go back to work. People be like, oh, what have you done? Not, oh, what have you done?
Oh, what haven't you done? Like, what's really
right. We want them to be like, what's in your bag and what's the secret? So that's filler. Filler's for volume.
But you use collagen for that.
Filler. Filler it's collagen-like. It's a gel substance.
Oh, so that's the name of it. It's called filler.
Yes, the whole category is called filler. So they're just injectables. And then you have the neurotoxin, which is like the Botox, Dysport, Xeomin type of treatments, and that helps with the lines, so the creases people have. So when people have creasing across the forehead, creases between the eyebrows, creases when they smile on the sides of the eyes. Yes, the crow's lines.
Feet. You
Yeah.
know, I knew that word. Yeah, crow's feet. You know, I knew that word. There you go. It's crow's
Listen
feet.
to 'em.
Yeah, you know, I know a little something, something.
You better teach
I
the
got to know a
people.
little something, something about everything.
So exactly, the crow's lines, and now you're going to talk about those. You get the bunny lines across the nose. You get the levens between your eyebrows.
See, you always got to show me about
I
about all
gotta
that.
get fancy.
You got to get all doctored on me. Like, I always my crow's feet. You got to get all doctored and stuff.
But that's where the neurotoxins, so the Botox is and Dysport and Xeomin, that's where we're injecting those into those areas, and they soften and relax the muscle. So if you relax the muscle, you can't contract it and make those lines or squeeze the skin together. So it softens those lines and gets rid of them. So sometimes it can bother people when they have permanent creasing on the face from dynamic movement, from smiles and frowns and such. So we can relax those muscles so they don't have those.
Oh.
So there's a lot of work, a lot of things we could do.
Yeah, that sounds like...
We have a lot of toys in the bag.
The more you talk, the more you sound like a doctor.
Okay,
Like
am I going to get my degree today?
You know, I think you might graduate today. I think you
Okay.
might graduate today because you sound like you know what you're talking about. Just a little bit. You might know what you're talking about just a little bit. All right, so I want to... There's this thing about baby hairs.
Oh,
What
yeah.
exactly does that? Because the hair does look different. Like, I'm looking at your hair and I see the edge, the little baby hairs right here. But the rest of your hair looks different. Is there a reason for that?
So these hairs along the frontal hairline, I guess and I'm guessing the storyline of how baby hairs came up is because babies usually have soft, fine hairs, usually sometimes encompass their hair early on. So the hairs that are along the frontal hairline, they're anchored a little bit more superficial in the scalp. So it's always like a tree in a trunk. The deeper the roots go, the thicker and wider the trunk. It can support a large trunk, the deeper the roots. Right? So if the roots are shallow, like a little baby tree that's starting to grow, look at a skinny little trunk, but it's also very shallow roots. So these hairs along the frontal hairline, they're shallow, they're more superficial, but so they can only anchor a smaller, finer hair in that area. And they're usually just one hair per follicle, or one hair per opening of pore, versus when you further back you go, you have 2, 3, 4, 5, some people even potentially 6 hairs out of one pore, 6 and up hairs out of one pore. So they're usually a different texture, they're finer. They lay a little differently.
They look completely different. Like,
and so that's with the baby hairs or the edges. That's what's at risk for a lot of people, the baby hairs. But now we're like smoothing them down, we're gelling them up, we're switching them to the left and to the right.
Yeah, we getting a little ridiculous with this baby. All right, bye. We getting a little ridiculous with this baby hair thing
Some
that we
of them
got
are
going
cute,
on.
some of them are cute, but some of them might be like, oh, they're snatching them out. You just gotta be careful. You don't want anything that's too much tension, because even if you're combing and brushing, you don't want to do it too hard, because the same thing as if you have a weave that's pulling on those little fine hairs. A brush is just as much friction, just as much tension. If you're brushing really hard, you're going to potentially pull those hairs right out.
Do they grow back?
If it's not traumatized, yes. Like if it's a hair that was going to naturally shed, then that's fine. But if it's a hair that's anchored in, the weakest point, remember, if it's a strong hair, if it's anchored in, it's going to get pulled out traumatically by the follicle, which means it's an open wound, which means the body doesn't know to regenerate a follicle. It just closes it up with scar tissue. Scar tissue, no hair. So be mindful of those baby hairs.
Well, I figured they were sensitive. I just
Uh-huh.
didn't know why they were sensitive. I was like, well, why we call them baby hairs?
Because they're just little vellus hairs. Is a type of hair that's anchored more superficial. They usually go through a growth cycle a little bit quicker, and they have a different curl pattern than the rest of the hair and texture.
That leads me to a question. So, men in waves. What? Yeah, let's get into that. 'Cause we talk about the women. What about the men in waves? Like, what is that? Is that a texture of hair or what is
That's
that?
the defined curl of men. The wave is the
Oh.
ultimate defined curl. It's the wave pattern. It's the curl pattern. They're all in the same direction. Especially when you get to those 360 waves, that just means they're literally combing and aligning all of those hairs and all those curly hairs. They're aligning them all in the same pattern, same distribution, and that's what leads to the wave.
Okay. Okay. Special products, because I go to Walmart and there's just this whole 2 aisles just filled with all kinds of crap, from shampoos to just.
You said because it got soap everywhere.
It's so overwhelming. Like, I can't even when I had hair, it was just like I don't know what to use and what not to use. So here's the question: for African American hair and non-African American hair, should we be using different types of products? Does it matter? Because I'm always mindful. Like when I wash that, not the Sassoon, it's the other thing, Garniers or something that you always see the non-black folks using on their commercials. And I'd be like, well, I want to try it, but I'm like, your hair's not gonna look like that if you use that, because that's not for your hair. Is that a thing? Like, because I know you have your own products, but yours are probably specifically for,
Well, mine's for scalp.
Yeah. So
My product is just for scalp only. It's not for hair. You don't wash
what's in
your
the
hair
bag?
with it.
What's in the bag?
What's in the bag? What you got in that
What's in the bag? I
bag?
just know you got a bag over there. What's the bag?
I have a little sample here. Actually, it's a full set for of Soca formula. So for dry, itchy, flaky scalp, the seborrheic dermatitis, one of the most common types of scalp conditions that could potentially lead to hair loss. It's just a pre-shampoo treatment. So this is when you on your way to the beautician or someplace and you're going to have to sit for a good 15, 30 minutes before you actually get into the chair.
I've always commended y'all for that. I'd have shot somebody. I've been on the news every week. That's ridiculous. I set an appointment at 2 and you don't see me until 5. Who does that?
Yeah,
And then it takes you an hour to do my hair, so I don't leave until almost 7 o'clock.
Yeah, I'm like a 1.5 hour situation. Yeah.
I mean, do you even go to somebody does your hair or you do your own hair?
Yeah, I can't handle this. I have someone that helps assist the situation.
Well, you should put them in your shop.
I know.
That's who you should get in your shop. That
I
way it's a
know.
one-stop shop for you. You have that. Okay, so look, I got an hour break. Make it happen.
I know.
You
Look,
should
I
do
tried.
it.
I had that one day. I was like, ooh. I just
mean-
walked from my office down the hallway and just sat in a chair. I was like, ooh.
I
This
need
is
you to make
nice.
life easy for you. You're a doctor.
Oh, I know.
So I need you to make life easy for you.
I know.
You're a doctor.
Look, I'm on the same wavelength. I got you.
I'm trying to look out for you, family. I'm trying to look out for you. You can make this easy in your life.
Appreciate
Make this
that.
easy for you, for yourself. All right, so I'm gonna hold for everybody that's watching on Facebook. This is what we got. Oh, it's so nicely packaged. It's got your name on it and everything.
Oh, she
What does
official.
formula number 1 mean? What does that mean?
So there's 2 formulas in there. So sometimes we have, in the directions, we switch it up at the 3rd week, and we go to the 2nd formula, and then we can switch it back to the 1st formula. So it just kind of is a pre-treatment on a scalp for the dry, itchy, flaky scalp, and it really helps. A lot of my patients that we've had them on, they come back. And these are ladies who've tried, and guys who've tried things for years. Things cause a lot of breakage and dryness of their hair. And after using this, they've noticed like they're not having the dryness in the hair. The scalp is cleared up. They're not having the itching, the redness, the irritation. So I think we're on to something here.
I think you are. You should be. You're a doctor.
I'm a doctor.
You're a doctor. You can pull this stuff off. You're a doctor. You can pull these things off. All right, so that's.
So yeah, we have this here. So if you want to have this as an not wrong, but as a giveaway for your viewers either on Instagram Live or Facebook Live or on the radio,
I think she
then
just issued. Okay, so that's. All right, I'll keep that to the side. I'm trying to think about how to give a good contest. I don't want to give that to anybody. That's some special stuff right there from the doctor. That's some special stuff from the doctor right there. To get your hair, them baby hairs in line and make you look real pretty and all that good stuff. All right, so because we're at 1:40, so we got about 10 minutes left. Anything we missed that you want to get into?
I think one thing to kind of recognize is we didn't talk about was inflammation in the scalp, which is a huge portion of hair loss conditions, especially in the African American community. And when I say inflammation, I'm talking about the immune cells revving up. So, like, my analogy is arthritis in the knee, okay?
Oh, God. Wait, you supposed to use stuff we would know. Those of us that are young, what are we going to know what arthritis look like?
Y'all heard about arthritis? You know someone in the family has some arthritis.
Yeah, grandma. She's like 89 years
and
old.
she always talks my knees or my hip. So think about that.
Fine,
So,
I'm going to ride with you, and I'm going to ride with you. We'll see where we end up at.
So arthritis is when those immune cells start going into that joint, and people can sometimes have swelling, they can have discomfort, pain in that area. The body can try to self-correct. The only way it knows how to do that is to start laying down scar tissue. So it starts changing the cartilage and turning into scar tissue.
And this is happening on your scalp.
This same process can happen on the scalp. And so it changes the function of that knee. Now, if you have scar tissue where you're supposed to have cartilage, that changes the whole function, how the knee bends and how you're able to walk on it. Now, that same concept happens on the scalp. Your immune cells start flooding into the scalp. People can have symptoms of itching, tenderness, pain, bruise-like feelings, scabs, crusting, excessive flaking. But over time, the body tries to self-heal. The best way it knows to self-heal is to start laying down that collagen or that scar tissue. Scar tissue does not grow hair. So when we start getting a lot of scarring on the scalp, we start getting into permanent hair loss. So kind of backtracking when we said time is follicles is very important to identify and have early detection, because if someone has an ongoing inflammatory process and chronic inflammation in the scalp, that can start leading to hair loss. And they may or may not have a family history of that. So those are the individuals that we want to capture very early. And that's why I say we don't need to be numb to our scalp. Our scalp is telling us what's going on. Sometimes even if we don't feel symptoms, we may see changes. And the old school saying, a lot of my patients, they come and they wait because they say they try to cover it up with a weave or cover it up with camouflaging techniques, or they're using, they're trying to do like hair grow treatments, but remember, scalp is simple. Grow hair, fight inflammation. If you're trying to grow hair, but there's a lot of inflammation there, you're not going to be able to grow hair. So all that hair grow treatment is not going to work if there's inflammation present.
So, I mean, what is it? So, is it like does it change colors and stuff like that? Like, what is it?
Sometimes it's visible to the naked eye. Sometimes it's not visible. It's very deep in the scalp.
So, if it just stops growing hair in places, and it's just literally stops growing, then you probably need to see somebody.
Even before then. I mean, if you see thinning in an area, if you feel symptoms in the scalp that don't go away after a routine wash, then you should probably look to see if you can find a dermatologist. We offer healthy scalp checks. A healthy scalp check is if someone has a family history, or if they're just concerned they may be having issues with the scalp or the hair. We just do we do a thorough kind of assessment of the scalp where we're looking through everything. We're starting at the scalp level, we're looking at the hairs, we're looking at the shaft of the hair, and we're looking at the ends of the hair. We're looking at porosity of hair, just to make sure there's nothing that you or anyone may be doing on a daily basis that could be causing hair changes or scalp issues. And then, of course, if there's something going on internally, because it's a medical condition. That's what I think people forget. It's a true medical condition when it's inflammatory scalp changes. We need to address it. We need to treat it.
That brought up a question. Male pattern baldness.
We got something for that, too. Go ahead.
You're a doctor. You got something for everything.
I guess I know about
Male pattern, what exactly is that? Like, is that something that's hereditary? What is that? What exactly is that?
So male pattern changes, also consistent with female pattern changes, is when DHT, which is a type of hormone, is actually a byproduct of testosterone. So your body makes testosterone, and then when it gets around an enzyme, or when it gets to the scalp, it changes to DHT. And DHT actually has the effect of miniaturizing follicles. So it makes the hairs grow finer and thinner every time they cycle out. Every time a new hair grows in that follicle, it's a finer, thinner hair. And so over time, the hairs become finer, that you have more see-through, more visibility of the scalp through the hair. And it happens in men and it happens in women. In men, it's usually either in the temples or in the crown scalp, and they can push forward or push back. In the women, it's usually their midline part becomes a little bit wider space. They can see more scalp in their midline part, or they can see through their hair a little bit better. Usually the women they'll maintain their frontal hairline, but it'll just get thinner at the top of the scalp. And some women will get their temples become thinner as well. So that's male pattern and female pattern thinning, also called androgenic alopecia or hormonal influence alopecia.
So for men, is it an age thing, or is it like how do you stop something like that? Or once it starts,
So-
it just that's it.
Once it starts, it's going to continue on its cycle. It's going to continue to progress. There is genetic stamps to it. So if there's a strong family history of thinning, usually every generation it can happen younger and younger, in guys or in women. But in the guys, it's usually following their mother's hairline, or excuse me, their mother's genetic line, on how the guys are, or like with their hair loss and their age of onset. I'm getting a lot of young guys now.
Seriously?
Oh yeah. A lot of young guys that have hair changes, and the question that's actually been a big question of why, whether it's dealing with stress in life, not saying the older generations and every other generation didn't have more stress, but maybe coping with the stress maybe differently. I don't know. Dietary changes. There's a lot of fads, like everyone's on keto, this, that, right? And so maybe there's not enough adequate protein stores that are in the daily nutritional status. Perhaps there's exposure to food, hormones in foods that are being eaten. So we don't really know, and then of course genetics, but we don't know exactly why they're occurring younger and younger. Or maybe they're just presenting younger and younger because they're like, I want to stop this. And they're more conscious of it. Everyone's more health forward these days. Everyone's all about their personal brand, especially with Instagram and Facebook. Everyone's trying to get their selfie games up.
Ridiculous.
But, and not to say that, not to take away from anything, because it's still their personal brand. Everyone wants to feel comfortable. And so if someone's not ready to, just let their natural progression occur, we can stop it. So usually we're doing kind of a customized topical for them to use that night to stop the DHT and regenerate the thickness of the hairs, or we're doing injectable treatments like platelet-rich plasma, which is all natural, where we can help thicken up the hairs in regards to everyone has a little pillow of hairs at the bottom of their follicle. So when the pillow of hairs gets finer and thinner and smaller, you're going to make a smaller, finer hair. So we're trying to plump up the pillows, so that way the hair becomes thicker. Hair transplants. I don't like to do hair transplants initially. I usually like to stabilize the scalp, reverse as much as possible, thicken up as much as possible, and then if someone is still a candidate, then we can talk about hair transplants. But a lot of times, just with injectable treatments and oral treatments or topical treatments, we can thicken them up appropriately.
Is it too late for me?
I gotta assess you.
I mean, is
see.
it too late for me? Like, I think all them years of, because I had an S curl for a while, and I think all them years of putting that stuff in my hair, the sperm hair out, so it just looks terrible. So I'm just decided to go bald. I'm like one of my niece and nephew pick at me. They call me Patches.
Oh,
It's quite
no.
hurtful. They're evil.
No.
They're evil. Javon Tamara evil.
Just call them out.
They call me Patches. They're evil. But I just figured it was easy to just cut it on off. But so you can actually stop male pattern baldness if it's caught early enough.
Yes. We can stop it. We can reverse it. And then at the worst scenario, you stop and pause it. At the most optimum scenario, then we're regrowing hair, rethickening hair.
So you can just prescribe medication too?
I can prescribe medicine.
Lord, you really is a medical doctor
yeah,
in this
I
place.
told you
I got a
now.
whole
Watch
new respect
out.
for I got a whole new respect because MD look nice after your last name. But I got a whole new respect for the doctor. That she can write pills, she can do surgery. Look, dermatologists are the real deal. If you didn't know that, you know. If you don't know, now you know. Dermatologists are the real deal. So I mean, okay. So tell me, because we down to about a good 9 minutes. So tell me, what do you enjoy about being a dermatologist? Like, what brings you joy when your clients come in and stuff like that?
I like being able to solve problems and solve issues that affect people's confidence. So to me, when someone comes in and, their confidence is at a 2 or 3, and they're telling me how they used to be at a 9, 10, and we're able to kind of swing the pendulum to get them back to where it's elevating, that is what brings me joy, because that tells me it's all worth it. I like getting results. I like it when my patients are happy with me. I like it when they feel in themselves, because then that says I did a good job. But it's not even just the adults; it's the kids. That's a whole nother level, though, because you
have the kids actually.
Yeah, we have, because kids can suffer from hair loss. There's an autoimmune condition called alopecia areata that can affect kids.
That's terrible.
It is. It's not a nice thing, because that's where they can get the smooth patches of the hair that just kind of fall out, which seems to be overnight. and it can just be little patches, or it could progress to be the whole scalp, or it could be every piece of hair on their body. And so usually those are young girls. Their ages between, ages between like 7 and 15 that it can be really aggressive with. And so those individuals, especially with their parents being very concerned, of course, those are like the best cases when we can get their hair to regrow, because it's a life of understanding what's going on and being able to help them with their self-esteem, especially around that age, which is super important.
Wow. All right. So let me see. And then the final couple of minutes we got. Women and hairdressers. What are some things they need to be conscious of when they're going to hairdressers or trying out new hairdressers and stuff like that? What do they need to be conscious of?
So be aware of how your scalp feels. If you feel like you're, if there's anything that's being done to your scalp that's really irritating, tender, or causing pain, that's not a good sign. If your stylist is more concerned about getting you that style for the day as opposed to maintaining your hair and the health of your hair, that's not the best option. Hair today, gone tomorrow situation, you don't want that. Which unfortunately,
you should coin that. That's a good phrase. You should coin that. That's a good phrase. Never heard that's a good phrase.
And then just making sure your stylist can, and just ask them like to take a look through your scalp and have them look at your scalp whenever they're doing either certain treatments or even on a every wash day basis, just so that way they can understand what's going on. Because a lot of times I do have patients that come in and say, my stylist saw a patch in my scalp, or my stylist said my follicles look weird, or my stylist said I have a lot of red sores or scabs in my scalp. And people don't know. People don't go like that. They don't touch their scalp or look in the mirror.
I mean, I do, because
as he strokes.
I play my hair all the time.
So, I think it's an important relationship. So if you trust someone to make sure you're looking good, also trust them and make sure they're taking care of your scalp and looking at your scalp as well.
Is that a skill set that a hairdresser should have, to be able to notice that kind of stuff?
I think it's important to have. In certain cosmetology schools, I think that's in the curriculum, to learn about skin, learn about the scalp, and to understand it, and know the conditions and the infectious conditions that can occur with scalp and hair. But I think it sometimes, and not for everyone, of course, not all stylists, but I think for some stylists it may fade out as they're focused more on the hair and styling the hair and kind of being in the moment as opposed to the long-term effect. And so that's why we have that internship and that class that can kind of bring them back and let them really know how to...
Talk more about it.
Yeah, it's called the Red Flags of Hair Loss. It's on our website. But the first part is online, where we kind of go through a whole curriculum of healthy scalp, unhealthy scalps, all the hair loss conditions, how to identify red flags of your clients that are sitting in your chairs, surveys that your clients can actually fill out, so that way you can start the dialogue and open the dialogue. Because sometimes, stylists will do certain things, and even barbers and trichologists, they'll know your head looks fine, your hair looks fine, things look good when you leave my shop, and then they come back for their touch-up, and it looks like who knows what did what. So it's like, what's also happening in the meantime, from when they leave your chair to when they return. They could be going home and putting all kinds of stuff on their scalp and on their hair. So it's also important to kind of understand that, and even like the pH and the science behind products. Because there's no one magic product, right? Someone finds one magic product and someone made another one. So it's kind of breaking down the science behind products, so that way you can really know how to assess your client's hair, so you can find out what are the better options for them. And not the product brand, but the product type that'd be best, whether they're dealing with dry hair, breakage, itchy scalps, or things like that.
All right. So how did they get in touch with the doctor?
How
did they get in touch with you?
So they can, if someone's just follow us on Instagram, they can follow us at Dr. Nikki Hill. If they need to make an appointment, you can call our office at 404-474-2301. And you can find other information on our website at socacenter.com.
All right. Mm-hmm. So give me, we got a couple more minutes. So what do you want to leave the listeners and the watchers with?
So I'm leaving you with, in the great scheme of healthy scalp, time is follicles, and early detection is key. And so if you feel something, If you see something happen on the scalp and it doesn't self-correct, I tell people give it 2 weeks.
I was going to say, is there a time limit before you...
Give it 2 weeks
You don't
or
want
two.
people knocking on your door every 2 minutes. Look, something just grew here. How long you had it? A day and a half? No. Look, did you just get your hair did? Yeah, well, that's probably what it is. Go home and call me tomorrow.
Yeah, I tell people if you give it 2 weeks or 2 good wash cycles, if it's still there, you still have no symptoms, it's still, still itchy or scabbing or having bumps, then we need to assess it. We need to look at it. So time is follicles, early detection is key. And then just incorporating your stylist as your healthy scalp check expert, just having them look at your scalp and tell you what's going on. If they identify anything, trust them, trust in their word, and go find a dermatologist that specializes in hair loss disorders to help.
So are you on a recommendation list, like for hospital and stuff? This comes up. Oh, well, I'll go see Dr.
I get referrals from doctors. I have there's some hair transplant surgeons that will refer to me and that's also something I do want to talk about, because sometimes hair transplant surgeons they're not. I mean, choose my words wisely. Not all hair transplant surgeons are dermatologists, and hair transplant surgeons can sometimes come from different medical backgrounds. And so you really want to make sure you have an accurate diagnosis first before you have any procedures done, before any surgeries are done for the hair, because you want to make sure you have the right diagnosis so you know what the best treatment option is. Not every treatment's for every type of hair loss. And the first thing we said on this show was there's over 20 different types of hair loss conditions. And so I've had patients, unfortunately, when they're referred to me from the hair transplant surgeon, because there's been a issue after the surgery, and it's because they transplanted someone who had inflammation. And it's kind of like if you were to take a flower from the backyard.
All right, for the flowers.
And it's in good soil, and then you put it in the front yard where the soil's not that great. You're not going to be able to serve that flower's not going to be able to survive. And so that's what happens. People pay all that money for a transplant. They have the surgery, and then they lose the hairs because there's still inflammation there. And so it's very important to make sure we have the diagnosis so we know if someone is an appropriate candidate for a hair transplant or any other procedures for that matter.
Even these words, transplant and surgeries and stuff, it gives me chills.
Scalpel.
Just so it makes
Stat.
Say CCs, 3 CCs.
I need 3 cc's. Stat.
All right, so there you have it, folks. Shouts out to my cousin Lauren for bringing us together as usual. Appreciate my family. Family's important. Family's forever.
Absolutely.
Always remember that. The lovely Dr. Hill for being here, who's soon to be cousin. I'm going to ask you about that when we get off the air. I need a date. I didn't want to put you on the spot up here. But shouts out to being here. Remember, you can get in touch with her on Instagram, Facebook, call the office. Tell them the name of your office. Tell them the name of your practice again.
Skin of Culture and Hair Center, or SOCA Center.
I was about to say, what's the acronym?
No,
That was the acronym. All right, so y'all definitely want to get in touch with her. Y'all will see her again. She's family. She's going to be at the conference later on, which you'll get more details about later on. And thank you guys for tuning in. We will see you on Friday, same time, same place, in an hour and a half. Run on over to the Now Network and watch my TV show, The Leadership Blend TV edition.
Yes.
Check your local listings for channels and times. They're on cable channels, people. If it's not in one of the 11 cities that you can actually watch it on TV, go to the nownetwork.org. Watch it there. And I'll see you at 3:30 again on the Leadership TV version. I'll see you again on Friday for the Leadership Live Radio version. So see you Friday, and stick around the Leadership Blend with your host, Ricardo D. Rice.
IBNX Radio.